Monte Carlo methods play a crucial role in epidemiology by simulating the spread of infectious diseases. These simulations help researchers and policymakers predict outbreaks, evaluate interventions, and develop strategies to control disease transmission. Why use Monte Carlo in epidemiology? Infectious diseases spread through complex interactions between individuals, making deterministic models insufficient. Monte Carlo simulations allow us to model disease transmission under different scenarios, estimate the probability of outbreaks in a population, assess the effectiveness of vaccination and quarantine measures. Key applications of Monte Carlo in epidemiology. Monte Carlo techniques are widely used in epidemiological studies, including disease spread simulation. Monte Carlo methods help model how diseases spread based on contact rates between individuals, transmission probabilities, population movement, and social interactions. By running thousands of simulations, researchers can estimate the likelihood of an outbreak under different conditions. Predicting epidemic trends. Monte Carlo simulations assist in forecasting epidemic trends by simulating the impact of different interventions, such as lockdowns and social distancing, estimating the peak of an outbreak, calculating the probability of disease eradication, vaccine and treatment strategy evaluation. Monte Carlo models help evaluate the impact of vaccination campaigns on disease spread, treatment effectiveness under uncertainty, herd immunity thresholds needed to prevent outbreaks, healthcare resource planning. Hospitals and governments use Monte Carlo simulations to predict hospitalizations and ICU demand, optimize the distribution of medical supplies and ventilators, plan emergency responses for future pandemics. Challenges of Monte Carlo in epidemiology. Despite their advantages, Monte Carlo methods have limitations, depend on accurate input data to make reliable predictions, computationally intensive for large-scale populations, require careful calibration to match real-world disease patterns. Conclusion: Monte Carlo simulations are a powerful tool for understanding and managing infectious disease outbreaks. By modeling different scenarios, these techniques help health organizations make informed decisions, improve response strategies, and ultimately save lives.